Before we go into introducing the panel, I would actually like to turn it over to the Honourable Katrina Chen, Minister of State for Childcare, who I'd like to invite to make some opening remarks.
Thank you so much, Shannon, and thank you all to all the childcare operators, early learning care professionals for taking your very valuable time this evening to join us for this very important conversation. I would also like to recognize that I'm speaking here from my community office here in Burnaby on the unceded traditional territories of the Coast Salish peoples, and thank the First Nations, Squamish, Musqueam, and Tsleil-Waututh nations for allowing us to live, work, and learn on this very beautiful land. And I really want to give a big thanks to our panelists today, Dr. Daly, Dr. McKee, Ms. Holmes from WorkSafe BC for taking the time to answer questions and share your expertise with us. I don't have to tell any of you on this call how this pandemic has really hit so many workforce and sectors in BC so hard, especially for childcare professionals who are the workforce behind the workforce. And your work is really key to BC's recovery. And I'm so grateful for all the hard work and dedication, the work that you do. And I have to say, while things are definitely not perfect, and unlike before, that we would at least have a few months or sometimes a year or two to work on the government policy or implementations of a new policy or program, we have been responding to this crisis and the ever-changing situation day to day the best we could and adjusting along the way. So I really want to thank everybody for your patience, your understanding, and your commitment to do the work you do and working with us along the way. So a lot of things have really changed during the past year, but our government's commitment to continue with our historical investment in childcare, to build the work that we've done from the past 3.5 years, and to work with all the professionals from the sector to build an inclusive, affordable, high quality early learning and care system for all BC families has not changed. We're committed to continue working with you together as the pandemic unfolds. And I really appreciate the stress and the uncertainty in these times. I understand, and I want to thank you all again for your critical work on the front lines. And I hope that this evening, through the support and the help of our Public Health and WorkSafe BC experts who are answering questions, that we can alleviate some of those stress that you're experiencing. So now I will turn it back again to Shannon, who will be taking your questions to our panel, and I'll be turning my camera off so we can focus on the panel. And I look forward to hearing the answers to the questions and also learning from you all. Thank you so much.
Wonderful. Thank you. Thank you, Minister Chen. So now, just before we jump in, I'll just take a moment to introduce our panel this evening. I'm pleased to be here alongside of Dr. Geoff McKee, who is the Medical Director of Population and Public Health at the BC Centre for Disease Control. Also, we have Dr. Patricia Daly, who is the Vice President, Public Health and Chief Medical Health Officer from our Vancouver Coastal Health Region, and Jacqueline Holmes, the Manager of Prevention and Field Services at WorkSafe BC. So to kick us off, I'll turn it over to Dr. McKee, who will give us that overview of the changes to the guidelines, and then we will turn to the questions for the panel. Dr. McKee?
Wonderful. Thanks so much, Shannon, and thank you for the opportunity to be here today and to share some of the changes that we've made to the guidelines and hopefully answer some of the questions. Before I do start, I just also want to acknowledge that I live, work, and play, and I'm calling in today from the unceded traditional territories of the Squamish, Musqueam, and Tsleil-Waututh peoples. Also just want to note, I know that some I've seen in the chat here haven't been able to access the document yet. It is live now on the BC Centre for Disease Control website at bccdc.ca. If you go to the COVID page and then to childcare, the document's in there, as well as some other resources to help kind of provide some context and a bit of a description around some of the elements of the childcare guidance document. So I invite you to go there. I'm not sure if it's been included in the chat yet, the link, but it should be able to be accessed through that. So I'll hopefully be able to go through a quick overview here, because just to provide some context for this revision of the guidance, there aren't a lot of substantial changes to practices. It's more a matter of clarifying some of the elements of the guidance and providing a little bit more detail based on some of the experiences that we've had throughout the pandemic since the first iteration of the guidance document. I think we've learned a lot. We've not only has evidence come out in the research around infection control practices and how best to implement some of the measures, but we've also learned on how the guidance document can be interpreted and can actually be implemented within certain settings. And so we've tried to include some of those changes in the document, and also at the same time to align it with some of the other changes of guidance documents that may also be relevant to the sector. For example, the K-12 school guidance document that was revised and came out a couple weeks ago. And so where possible, we've tried to align these two documents as they're both based on very similar practices. And all of this comes back to some very basic public health principles that we've tried to implement in a way that can be easily actioned within the childcare setting. So just going through this, given that a lot of it's just clarity on wording, I just want to provide a basic overview of some of the basic amendments here. To start off with, we recognize that there may be some differences in practice in the childcare setting, and so we tried to provide some context for what makes the childcare setting unique and what are we basing some of these decisions on. So you'll note there's a bit of a description at the beginning of the guidance document that states some of these differences, particularly from K-12 schools. We know that these services often serve a very young children in the childcare setting. And we know that young children have different risks of being infected. They're much lower risk of being infected, much lower risk of experiencing disease and becoming cases and transmitting the virus. And so that provides us with a place to start in developing some of these guidance documents. We also know that there's different types of adult-child interactions within the environment, and it can also be a less structured environment due to the different developmental stages and needs of infants and young children. And so given some of these differences, you may find some variations throughout the document, but where possible, we've tried to align them because they are all based on the same public health principles. We've added a little bit more guidance as well around interpreting illness within young children, a little bit of information on how symptoms can present differently in kids because kids don't experience things quite the same way as adults. But really a lot of the basic background stays the same in this document. So now starting to go through the different areas of the measures within the guidance document. You'll see that there's that typical triangle that many people are quite familiar with now. You'll see it in a lot of different public health documents. And this is called the hierarchy of controls, which is pretty much a fancy way of providing an upside down triangle, which has the most important things at the top and the least important things at the bottom. Now, they all need to be considered, but the top of that pyramid are the ones that are most effective, and the bottom is those that are least effective. And that's going to be consistent, and that doesn't change because these are the basic public health principles. So I'll go through them very shortly here. The first one is the environmental measures section. Some changes or additions were made under a few of these sections. Ventilation has been a hot topic, and many have probably heard various things, discussions about the importance of ventilation. Much of the guidance in this document hasn't changed with ventilation. There's still a few basic principles that we know. We have added in some basic description that that ventilation alone does not prevent infection. It can help support reductions in transmission, but only with more important preventive measures in place. Now, we also included a bit of a more focus on just maintaining HVAC systems where they're implemented, and then also opening window, because air exchange is important here, not just air circulation, because if you have air circulation, it still circulates the virus within a room. It's more about air exchange. So that's where the focus came in for the ventilation. The next section on cleaning and disinfection, again, we just really added more detail in this section. So you'll see that there's a little bit of a change on some of the types of items that we're recommending cleaning for. We've learned throughout the pandemic that the virus, a lot of transmission doesn't occur with virus on surfaces. That doesn't mean cleaning frequently touched surfaces isn't important, but it does mean that we can interpret it differently, particularly for hard to clean items. So we've changed some of the descriptions in here, particularly saying that you should try to consider limiting the use of frequently touched items that cannot be easily cleaned, but to those that support learning, health, and development. So this is where some of your own interpretation comes in that we need to think about what are the essential items that we want in this environment, and then manage it accordingly. We've increased the emphasis on hand hygiene, particularly related to certain practices such as toileting, as well as after changing diapers. And then for the use of some of the toys and materials like manipulatives that kids can still use, and we've learned that can be used safely, we should emphasize hand hygiene after using those. Even though the transmission risk might be low, it's good practice to get into to maintain good hygiene. There's a little bit more information on cots and bedding. I don't think this was included in the same level of detail in the previous guidance document. But again, we go back to the principle that if you have a cot or bedding, it should try to be maintained only for a single child. And then anytime in between use of that material, or at least once a week, it should be cleaned. And if soiled, it should be cleaned. So next level on that triangle is administrative measures. There wasn't a lot of change in this area. I guess the one main change within the section was under visitors. I don't think there was a lot of detail in the previous version. We really brought this back to some kind of common sense practices that visitors should only be limited to those who support activities that are of benefit to the child's learning and well-being. This is again in reducing contacts, but acknowledging that there may be certain visitors, there may be certain adults in the space that may be supportive to the practices of the childcare. And so for when we do have these visitors who are entering the childcare facility, there's some wording in the guidance documents to support active symptom checks. So we want to make sure that adults are not entering the childcare facility while they're symptomatic. And also we've advised that they should wear a mask when they're indoors within the setting. And this may be similar to masking guidance you see in other sectors as well. So throughout the next section, there wasn't that much more change to the administrative measures. Other parts of that section were such as transportation, food and beverages, cohorting children and staff, those stayed relatively the same. The next section is under personal measures. Here again, some of the information was just expanded and more detail was provided on it. The daily health check was included in more detail in this time, and this is to support that practice of having everyone check themselves for symptoms before they enter the childcare facility each day, and then make sure that we're avoiding people who are sick coming to work or to the daycare. So the focus on this section is on communication. So it's not necessarily about actively checking everyone for symptoms, although there may be certain practices for that with staff or some adults, but it's really trying to support people to get into this practice on their own. So it's ensuring staff and parents are aware they should be doing a daily health check before entering the setting each day, and that parents should then be aware and responsible to check their child for symptoms before they enter the childcare each day as well, and stay home if they're sick. Now, some of the other sections here on what to do when sick, what to do when symptoms develop while at a childcare, again, the practice didn't necessarily change. We just provided more description in here on what to do. And also some new tools had been developed. So we've tried to include links where possible. Again, hand hygiene, we've tried to emphasize in this. Particularly the times when it's important to make sure you're washing your hands, such as before and after eating, as well as after toileting and changing diapers. And we also added a little bit of a section on just checking the labels on hand sanitizers before having them used with kids. There may be different ways to use them, and some hand sanitizers may not be necessarily the best to be used for children. And so always just check the labels before using them in that setting. Finally, I think the most substantive and probably change in the document was around masks. And again, I want to start this with saying that masks are the lowest on the hierarchy. They are the least effective of all these measures, but they may add some added benefit in certain situations. So we did add some more language in this section, in part to align with the K-12 guidance. But there are some differences between the childcare setting and the K-12 setting that we tried to address here as well. For the children, we actually aligned very closely with the K-12 guidance in that elementary school students could choose, or their family could choose for them to wear masks. So this is a voluntary decision. And this is the same for in childcare settings as well. We should note that masks shouldn't be used on infants less than 2 years of age because it may make it difficult for them to breathe. And also that childcare staff should supervise and support children to safely wear the masks. And again, this should be done in a supportive setting, and we have similar wording in educational settings as well. In that we want, if they are choosing to wear masks, it should be done safely and effectively as well. And we should, and where possible, to avoid anything that might stigmatize the child, or there's different ways to approach mask wearing around this. And so we really want it to be a positive experience. Now, for staff and other adults, the focus is really on adult-adult interaction, because that's often where the higher risk transmissions can occur. And so we focused on having staff and other adults wearing a mask when indoors and interacting with other adults, except for a few situations. One is that they consistently maintain physical distance. There could be a barrier in place. Now, a barrier could be plexiglass, could also be a wall. If you're in a room by yourself, you don't necessarily need to wear a mask, or when you're eating and drinking as well. Now, given the guidelines, the other interaction where we wanted to address was in the adult-child interaction. And this is one slight difference from in K-12 environments. And there's various reasons why we've made it optional in this case for adults to wear a mask around children. And so, first of all, there are multiple effective health and safety measures in place that are much more effective than a mask. So that's the first piece here. Young children are also less likely to be infected and less likely to transmit virus. We also know there's other differences. There's different types of interactions and needs in the childcare setting where a mask may not be as effective or as useful. And there's also different sizes of cohorts and different numbers of contacts. So these are very different settings in many ways than the elementary school setting. And that's one reason why we went with this flexibility of the mask guidance for adults. Also, we wanted to make sure that there's consideration also, if you choose to wear a mask, on the impact of mask wearing on visual cueing and other nonverbal communication with children, as these interactions can play an important role in learning and development. I think that the evidence is still coming out on what masks actually do as part of that interaction. But I think based on prior evidence, what we know about the role of visual cueing and the ability to visualize emotions, language, etc., it's, I think, important consideration when we're looking at obscuring the face when interacting with young children. So those are basically a basic overview of the amendments to the guidance. Again, they're fairly minor overall, but I know we were going to get a chance to go through some questions, so thanks.
Great. Thank you very much, Dr. McKee. We certainly appreciate that overview and drawing our attention to where the changes are in particular. So now I'm going to, we did get quite a few questions in ahead of time, so thank you very much to childcare providers for letting us know what's on your mind in terms of some of these questions. So I'm going to jump right in because we might possibly even have more than we have time to cover. So I'm going to jump in with some of the questions that we did receive about masks, because as you said, Dr. McKee, this is the most substantive change in the document, notwithstanding it's the lowest on the hierarchy. But here we go. This is the first question. So really, it's just straight out. So when should staff be wearing masks around the children, around school-age children, during drop-off, pickup, just sort of all of those different scenarios within a childcare setting? Can you maybe give some explicit guidance on that?
Sure, happy to. I think so. I guess when adult staff should wear a mask in the case would be in interactions with other adults, particularly indoors. When they're outdoors, it's much less effective and much less necessary in an outdoor setting. But for indoor environments, when you're unable to maintain that physical distance from another adult, that's when there may be some value for wearing a mask in those interactions. Now, for interactions with children, again, this should be a personal choice, considering the different types of interactions that you're having with the child, and also considering some of the other things that were mentioned previously in the guidance. But it's really going to be around those adult interactions. Now, if you're able to be 2 meters away from somebody, you're eating lunch or something like that, it's safe to take off your mask in that instance. But if you're going to be interacting, say, around a table where you're not 2 meters apart from another adult and you're having a face-to-face conversation, that's an instance where it may be of value to put on a mask.
Okay, great, thank you. And another question related to masks. Do school-aged kids in before and after school care have to wear masks? And what if the children come from multiple schools?
Yeah, so in this case, again, based on the wording that we've used in the guidance, that children, it should be optional on whether they choose to wear masks or not. And that can be based on their decision or as well as in their family's decision, and acknowledging that really young kids may not be in a place to make that decision themselves. Now, the one thing to note is that we didn't put an age on the children as noted in the guidance here. But in most cases, it will be elementary school age children or younger, usually younger. And so it really is consistent with the K-12 guidance as well as it being optional in that case. So it shouldn't matter if they're from different schools in this case. It's really for all children, because particularly if they're part of a consistent cohort here, they're really limited in their contacts outside of that. So.
Okay, great. And I'm not sure if this is a question for yourself, Dr. McKee, or if this would be for Dr. Daly, but wondering about childcare operations when the childcare facility is in the childcare provider's home. So question is, are the childcare guidelines different for childcares operating out of the home, or are they implemented in a different way?
So happy to answer that, Shannon. First of all, I'd like to say hello to everyone and also acknowledge I'm joining you gratefully from the territory of the Coast Salish people, Musqueam, Squamish, and Tsleil-Waututh. And I'm really happy to see how many people have joined the Zoom call tonight. I'm seeing all the people from around the province join. And I want to thank all you childcare providers who've been out there providing an essential service since the start of the pandemic. I remember talking to some of you in the early days, and you open your doors, and it's really been critical for the health and well-being of our population to have you open, to get our society restarted. So thank you so much. And we've learned so much since those early days that actually gives us a lot of assurance now in some of the things that Geoff is telling you, that we now know that you're safer than we even imagined in a childcare setting, because children are definitely, even in BC, we've got data to show they're less likely, especially young children, to both acquire and transmit COVID. So I will say that the principles are the same regardless of where your childcare is located, if it's in your home or in any. I see some questions around schools or other buildings. There are guidelines, and if you're uncertain about how you might implement them, that's where licensing officers can help you. Our goal is to help you implement the guidelines as best as you can wherever you're operating.
Great, thank you very much. Now this one is a question that has come up a few times, and it is if we operate, so if childcare facilities operate in a school or operate a before or after school program, which guidelines do they follow? Do they follow the childcare guidelines, or do they follow the K-12 guidelines?
I'm happy to start off that one. So in general, the guidelines are very close. You'll notice that the K-12 guidance is a bit more detailed, and it's addressing more complex setting in some ways. But there's very few differences. We actually pretty much use the same paragraphs in many of the instances in the childcare document as we did in the K-12 document, because a lot of the principles are quite the same. Now, there may be some differences that are very unique to the school setting. And in that case, there may be additional guidance that may be valuable to follow within the school setting as well. Some of this may also depend on how the programs are set up at the school, whether or not they will also need to follow the specific guidance within that school's health and safety plan. So I think there's not too many areas where the guidance documents are going to conflict. And it may, if you're going to operate within a school setting, it may be worthwhile having a look at both documents and also being in contact with the school to make sure that you're following the appropriate guidance for that setting.
Great, thank you. The next question is a little bit different, or I should say on a slightly different subject. So if someone in a child's home has been exposed or tested positive and been told to isolate, can the child still come to care?
You want me to answer, Geoff, that one, Geoff? Because we do get some confusion around this. So If we have a case of COVID-19 diagnosed in a household, generally everyone living in that household is considered a close contact, and they would be required to isolate for 14 days, and they will be followed by public health. The only time that wouldn't happen, sometimes we get a returning traveler who is, they might be quarantining in a basement away from the rest of the family when their symptoms develop. But generally, if there's a confirmed case in a household, everyone has to isolate. Where we get confusion is if someone is isolating because they are a contact of a case. And this often occurs in children. So let's say we have a school-aged child who's identified as a close contact of a case. They're home now for their 14 days of isolating because they were a contact. And they have a sibling who goes to daycare. That sibling can still go to daycare because they are not a contact of a confirmed case. So this is often a source of confusion. The children in daycare need to, if they themselves are a close contact, will be at home isolating, followed by public health. But if their sibling or another household member is a contact of a case, then the children can still go to daycare. If that family member becomes a case, then they would have to isolate, but not just if they're a contact of a contact, so to speak.
Thank you. Thank you, Dr. Daly. Our next question is also a little bit different. Is it safe to run a childcare in a small room without ventilation? And an example is given of, for example, a portable. I'm not sure if that would be a Dr. Daly question or if that's a Jacqueline question.
I'm happy to start it, but there might be different perspectives here too. It may be worth kind of getting a WorkSafe perspective as well.
Yeah, that's right.
But I can say, I guess, just starting off with the added value of ventilation. So ventilation can be of added benefit, prevent accumulation of the virus within a space, right? But it's not sufficient to prevent infection without other more effective measures in place. So we're now talking about an environment where there's multiple measures that are effective in place, and then adding on ventilation on top of that here right now. So it can have some added value, but I think we have to think about it within that. So when you're approaching kind of this scenario of a portable, I think it's also important to consider the other measures that can be done to also help reduce the amount of contact. So when you're considering activities in the space, how are you making the use of the most space within the portable there? Are there windows in the portable that you can open a little bit, provide a breeze? And is there an option also to take some of the activities outdoors where there's better ventilation as well and lower risk? So I think we can't look at the ventilation alone in this scenario. We have to look at it within the context of all the different measures that are in place within the facility. So I think that's kind of, it's maybe a more complicated approach to it. I think we can always consider ventilation, but we have to consider its added benefit in addition to all the other measures in place. And I always suggest that we have to consider those first before we get to some of the less effective measures. So maybe I'll pass it over to either Dr. Daly or Jacqueline for their perspective.
Okay, this is a really good question. Hello, everybody. Good evening and welcome. I'm basically WorkSafe BC is along for the ride tonight in this webinar. I do have a little bit to offer in that WorkSafe BC Prevention, we are the regulator for health and safety for provincial workplaces. So we're concerned with what employers are doing to keep their workers safe. And of course that spills over into the public, your clients, your kids, and so on. But the ventilation question does come up quite a bit, and it has come up with the K-12 group as well. And I'm also on the manager of interest of that group, and we've had lots of discussion around this. And further to Dr. McKee's answer about other ways to do work in a space, a lot of the schools and a lot of daycares and a lot of businesses don't have great ventilation, or maybe none at all in some cases. So it's not the all end all be all. It is one of the controls. However, we have had conversations with employers about that. And if you do have ventilation systems, we do expect that the employer maintains them and has them regularly serviced and that they're in good working order. But again, for those workspaces and spaces, childcare spaces that are in portables where ventilation is probably your door or your windows, that's also good as well. So ventilation is just an aspect, but we expect them, WorkSafe BC would expect that they'd be in good working order if there was a system in place.
And just to say practically, you know, I get concerned when there's suggesting a school or a daycare needs to invest in an expensive ventilation system. We would not recommend that. And I would say we haven't had any clusters where we think that poor ventilation has been an issue in either a school or a daycare. So, you know, I wouldn't be going out and having to buy expensive new systems.
Okay, good. That was a really well-rounded response to that question. So thank you very much, all three of you, for contributing to that one. The next question actually is a little bit more into the grouping of mask questions. It says, how do the measures being put in place take into account the effects that they may have on young children's social, emotional, and language development?
I'm happy to start this one off, but again, there's probably a lot of different perspectives here as well. So I definitely appreciate any feedback from my colleagues as well. But I think it's a very important question, because whenever we're looking at the development of public health measures or any public health restrictions, we want to only offer or recommend the minimum necessary in order to have the effect that we want in controlling transmission. And this is part of our ethical principles in public health, in that we want to avoid any harms to anybody. So this would include the recommendations for any sort of public health measures in a childcare setting, because as Dr. Daly very eloquently put it earlier, they are essential services within society, and they provide essential opportunities for development, learning, and child well-being. And so we want to make sure that we're very cautious in recommending any sort of restrictive measures within these facilities, because we don't want it to interfere with child development, as was mentioned in this question. And so I think the development of these guidelines, we really tried to take that into account as we were looking at the various different measures that could be implemented to make sure that we're reducing any potential unintended consequences. Now, that being said, it is a balance here, and we do have to recognize that there may be certain unintended consequences for this. And so we have to take measures wherever possible to ensure that we're not reducing children's access to childcare services, that we're not creating environments that might be more stressful for them, and that we're also not interfering with very positive interactions that they need for good development. And so when we're looking at things like the masking recommendations, we really needed to take that into consideration. And that's one reason why we were very explicit in the guidance to make that a consideration when choosing to wear a mask in those interactions.
Great, thank you. Okay, our next question is, if a child or staff member is sick and stays home, do they need a negative test in order to return, or is it enough if the symptoms have resolved?
Well, I can start. I think it depends. First of all, we don't require a negative test to come back to it, even someone who's had COVID-19. So I'm presuming that this is somebody who's tested positive for COVID-19. The test that we do can actually remain positive for a period for long after people are no longer infectious to others. So we will isolate cases for 10 days. And after that, if their symptoms are resolved or resolving, they're not infectious and they can return to daycare, for example, if it's a child or if it's one of the staff members as well. They may have some residual symptoms, but they're no longer infectious to others. So absolutely not. We do not require a negative test, even if someone who's diagnosed with COVID-19 to return. I know we're going to get to some other questions later about if people are sick and let's say they test negative or they choose not to go for testing. You will see in the guidelines that's addressed. I don't know if you want to go over that, Dr. McKee, but we don't necessarily require that symptoms be resolved before people can come back to daycare.
Dr. McKee, did you want to comment on that before we move on to the next question?
Yeah, sure. So there is some language within this, particularly if there's a negative test, then it's likely to be something else. And in that case, there's other illnesses, obviously, that we would need to be aware of, that we're so focused on COVID often. If somebody's sick and with a negative test, that doesn't mean they don't have something else, like a GI illness or something like that they might be able to spread. And so this is very similar to how we manage any other illnesses in this setting, that when their illness is, their symptoms are resolved enough that they can fully participate again, and usually they're well enough to return to practice, And so that's kind of the language that we used in this case, particularly for when there's a negative test. Now, that being said, as well, this also recognizes that even with COVID-19, once they test positive, they could have a cough for quite a number of weeks after they're no longer infectious. So we have to recognize as well that various illnesses may have symptoms that go on for quite some time when they're not infectious anymore. So that's one reason why we need to create some. That's why the language was created the way it is, to recognize that some symptoms go on for longer periods of time. Also acknowledging that there's other scenarios as well where someone might experience symptoms that may be of concern to some people, but may be baseline for that individual. For example, there may be someone who has allergies and they may have no change in their symptoms, but they may have a runny nose or something when they're exposed to certain pollen or other allergens. And so I think we have to also recognize that there may be a baseline for an individual child or staff member that they also would have to take into consideration when coming back to work.
Okay, thank you. I'm going to ask maybe one more question along this vein, and then I'll move to another topic. So the question is, in what situation or situations can a childcare provider require a child to get a COVID test before they can return safely to care? So in what situation, I guess, can the childcare provider simply require that the child go and get tested?
We can never force any child to be tested. Even as a parent, I can tell you I had a case over the weekend where parents brought a child into an urgent care center, and they actually wanted the child tested. And the doctor called me and said, I don't think I need to test this child. They did have new onset of symptoms. Their parents were both positive cases. And you actually don't even need a test in that scenario, because we called that case a COVID case and we managed them without a test. So that's kind of the other side of the coin, that we made the diagnosis of COVID without having to do a test. But you as a daycare provider can never require a child be tested. I've had some scenarios like this, not so much recently, but early on, that some daycare providers, they noticed the child might have some symptoms and said the parent had to take the child for testing. I think Dr. McKee's outlined to you that, first of all, our threshold for testing has changed as we've learned more about COVID-19. That even if you do the COVID assessment as a child, we wouldn't send a child for testing if they only had a runny nose, for example. It really is the symptoms that we know are more characteristic of COVID-19, which is new onset of fever and cough or shortness of breath or loss of sense of smell or taste. Those are really characteristic of COVID, but even in those scenarios, most people who go for testing are negative. They do not have COVID-19. I think if you're concerned about new onset of symptoms in a child, you advise the parents, and most parents will go through the assessment and will either call 811 or determine if their child needs to be tested or not. If you really have concerns, and I don't think this happens very often, perhaps you don't trust the parent, you think that perhaps the child has been exposed to COVID, you can call your licensing officer and ask for advice, but we can advise you around those scenarios. But generally, parents want to know. They, of course, are concerned about their child's health, so they will do the assessment. But just to let you know that the threshold for testing now has changed, because there were so few positive among kids presenting with some of those more common symptoms like runny nose and other things, that we don't recommend testing for those symptoms generally anymore.
Good, thank you. Okay, I'm going to move on to another subject, and I'm actually going to put two questions together, just sort of watching the time tick away here. So the question is about ratios and labor market shortages. And so two together, can sick childcare staff still work given the shortage of ECEs? And along that same line, why are child to staff ratios not being revised? Dr. Daly, I'm wondering if that's yours.
Yeah, sure, and Dr. McKee can add to this. So if a staff member has COVID-19, they must follow public health guidance. So we've had this about healthcare workers too. You have to be home, you have to isolate until you're considered not infectious to others. So even among healthcare staff that think that they're essential. So the guidance around whether you should work does not change just because you work in childcare. And we have had some cases, I will say, of staff in childcare who developed COVID-19. The vast majority are people who acquired it outside of the daycare setting from another kind of contact, and they do have to stay off work until they're cleared by public health. So that will happen. In terms of ratios, the ratios we feel are appropriate, even in the context of COVID-19. I think behind that question is that staff may find it difficult to manage all the things they have to do around guidelines in the context of COVID-19. I'm hoping that the new guidance will make it a little bit easier for you. I know some of the concerns we've had, and we've had this from the school setting as well, or some of the requirements that used to be around cleaning and disinfection and manipulatives and other things. And hopefully that it's easier now that you go through the guidelines. But certainly in the context of even in the pandemic, we believe the ratios provide a safe environment for all children.
Dr. McKee, I was just checking to see if you wanted to add to that or if we should move on to the next.
No, I think Dr. Daly summed it up very well, so
Okay.
I don't have much to add.
Very good. And I'm going to ask just one more question sort of in this envelope, and because I think this is presents a difficult situation for some childcare providers, and they're wondering about how they might manage parents or co-workers who they're aware are not following the guidelines or provincial restrictions. What would your advice in managing that in their childcare setting?
Yeah, I think it depends what the situation is. I think, if you're in the workplace, and Jacqueline might want to talk about this, of course, we want to support our co-workers to follow the guidelines. But I think behind this question is, I think that person went on a holiday somewhere. I think that they had someone to their house. I really encourage you not to be the COVID police. I mean, I get these emails all the time from the public. I think we just have to trust that people are doing their very best to protect themselves. And we generally see that. So, but I think, Jacqueline, maybe you want to comment in a workplace, how you support colleagues.
Yes, thank you. And this one I smiled a little at because I do see and hear about this a lot. If people are not following what is in place in terms of the employer, and I'm speaking to employers now, so that would be as childcare providers and you're in charge. So you should have safety plans in place. And if you have people coming into your facility that are not following the safety plan and your requirements, they need to follow them, period, end of story. And this is what we would expect of employers to do of anybody. And that's even when we go in and we inspect restaurants, we expect that the person in charge, the manager of the restaurant, is holding people accountable to their policy and what's in their policy. And if they aren't, they ask them to leave. This is very tough, especially when you may encounter people who refuse to do what you have in place in your safety plan, but it is your responsibility to ensure that that's done. And it does get very tense at times. And certainly we have seen that as well. And in terms of thinking about what people are doing on weekends away and so on, we could dream up all kinds of things that people are doing or not doing. And public health has seen it all. I've seen some of the rosters of what the kinds of questions they get over the weekends, and people in their own homes and their neighbors and whatnot. It's quite interesting. But yeah, do your best to ensure that everybody's following what you have in place. And we would expect that as the regulator for employers to do.
Good, thank you. Thank you very much for the answers to that question. One about this one, I think is pertaining to one of the changes, so I want to make sure we squeeze this one in here. Do childcare providers now need to have a daily written record of the health checks from everyone who enters the facility, or is a verbal check enough?
I can speak to kind of the guidance and what it says in the guidance is that we've tried to suggest that for adults and staff going in, there should be an active check. Now that can take a few different forms, but they should be encouraged to check on their symptoms before they're coming in. On the flip side, for children, it really should be within the realm of the parents to be screening them. And so we wouldn't be expecting the children to be screened by staff every time they show up. This is similar to schools, in that the responsibility is put on the parents. And this is done in a way to support through positive communication, supporting that practice as kind of really everybody in our society should be doing this every day. Before you go out to the grocery store, you should be doing a health check, right? So we want this to become routine practice, I think, for folks before they pretty much do anything. And so the guidance doesn't really speak to exactly what that active health check should be. I think perhaps my colleagues maybe WorkSafe might have another perspective particularly for staff. But yeah, that just speaks at least to the guidance document.
Yes, this has come up actually in the K-12 group, and WorkSafe BC generally, we like documentation of things like that. However, we are looking at the guidance document, and as long as it's being done, we are not going to get into the nuances of did you write it down or not. There has to be an active way, whether it's verbal or written. And each employer will do things slightly different. Some employers have people sign in. Some people scan in on a barcode and fill out a form. But we just want it done and actively done. But we don't really have a position if you write it down every day, but as long as it's done.
And can I just say that just our experience and there's screening done in all kinds of places, long-term care facilities, healthcare facilities, and it can become a little bit, just something that you have to do when you come in and not an active check. And one of the things that we've seen in a lot of settings, even among healthcare workers, is they feel such an obligation to come to work that they may choose to minimize mild symptoms. And that may be in your childcare settings as well, that, that people are very committed to their work. They may worry that there won't be enough staff if they don't come in. And it may even be subconscious that especially for young, healthy adults in whom symptoms may be mild, they don't want to acknowledge symptoms. So it's more important that staff know that they should identify if they have symptoms and they feel comfortable staying off work if those symptoms do develop. Because I think in our experience, that's been the challenge rather than how the screening is done.
Great, thank you. And this might be the last category of questions, depending upon the nature of the answer. So again, I'm going to group a few questions together and allow a little bit of a conversation on it. So this is about childcare workers getting vaccinated. So the question is, of course, when will childcare workers get vaccinated? Will it be at the same time, I should say, as teachers? And can you also address whether vaccination for childcare providers will be mandatory? Yeah, so I think that sort of groups the questions together here. And perhaps we can start with Dr. Daly on that, if that's okay.
Sure. So we are going to be, the vaccinations are coming. They've been kind of trickling into the province. As some of you know, we haven't even done all our healthcare workers yet. We will be getting more vaccine in April to start the broader population, and actually quite a large number of doses between April and June. We know that in public health that the risk of, our goal is really to prevent severe illness and death, first of all. And that's why we started vaccinating in long-term care and assisted living, and we're doing some healthcare settings. And as the vaccination rolls out to the general public, it will be by age cohorts. We're going to start with the oldest members of our population first, those over 80 years of age, and work our way backwards. We are not prioritizing workers necessarily in any setting, apart from those in places like healthcare settings, some congregate settings like group homes and other places. But by and large, you will be vaccinated when your age cohort is called. So for young, healthy people working in childcare or settings, it might be later than older workers, for example, because the risk of severe illness is higher in those who are older. We will never make it mandatory. Even in a healthcare setting, we do not require mandatory vaccination here in BC. We certainly encourage people to be vaccinated. And when your turn comes up, if you have questions, I encourage you. For example, I know many childcare workers are women of childbearing age. We have been vaccinating pregnant women who are healthcare workers. If you have questions around whether or not you should get vaccinated, certainly you can talk to your doctor, or there will be clinics available at the time where you can ask questions. But it's likely to be, you're likely to be vaccinated when your age cohort is called forward for vaccination. I can't give you exact dates.
Thank you. And just one sort of tag on question on here, and I don't know, Dr. Daly, if this would be yours or if Jacqueline, perhaps yours. Now, you did say, Dr. Daly, that vaccinations are not mandatory. What if childcare providers choose not to be vaccinated? And I think the question about this is, you know, if there's any risk to that in the workplace.
So the question then is if they choose not to, and Dr. Daly is correct in that we can't force people to be vaccinated. We never have been able to. We do strongly recommend. And this is true for healthcare settings as well. And so I'm not sure what your question was exactly around that. Could you repeat that, please?
Well, the question was simply is, you know, whether this was mandatory, which has been provided an answer to, and simply, you know, what are childcare providers to do or childcare operators to do if some childcare providers refuse to be vaccinated? And it sounds to me, and correct me if I'm wrong, but it sounds to me from a public health perspective that you're not requiring it, and perhaps from a WorkSafe BC perspective that that this is not something that is enforceable from a regulatory perspective, because indeed it's not mandatory. So it's a little bit of a circular piece. Would that be accurate?
Yeah. In terms of enforceable, if we look at the hepatitis vaccine, and if there's a workplace where workers could be potentially come in contact with blood or body fluids, such as a first aid attendant, we would expect by regulation that the employer has offered it to a worker, to a first aid attendant, but there's not the expectation that is mandatory.
And I would say there are two reasons to be vaccinated. One is for your personal protection, but we also, we want to get enough people vaccinated in our population that we can really limit the spread of COVID-19, and that's what will end the pandemic. Doesn't mean that it's going to be eliminated altogether, and it doesn't mean that everybody has to be vaccinated for that to occur. So, you know, there are some people who will choose not to be vaccinated. There are some people who may not be able to be vaccinated for a small number of people. But if we get to a high enough coverage within the population, we will limit spread. So I think for the individual worker, you know, there's two reasons to be vaccinated. One is for your personal protection, but one is that you're contributing now to what we call that overall immunity in the population. But it's not required. You know, if there are questions about it and you're worried about the vaccine, that's what I would encourage you to ask a trusted provider, your healthcare provider, if you're considering it.
Great, good. And I think I'll let Dr. McKee have the last word on this piece.
Thanks. I think Dr. Daly and Jacqueline covered it well. I think the one additional piece that I just add here, and perhaps part of this question as well, is that if you are vaccinated, do you still have to continue doing the other preventive measures right now? And as long as these restrictions are in place, as long as the measures are in place and the provincial health orders are in place, even if you are vaccinated, you are still expected to follow those other preventive and infection control measures and all of the orders at the moment. Now, the hope is that once we get enough people vaccinated, as Dr. Daly mentioned, that we will bring the case risk down, or the risk of transmission of COVID down enough that some of that measures start to be relaxed. But at the moment, being vaccinated does not mean you do not have to follow those preventions. So that just may be one other element to that answer.
Good.
And you still need to quarantine if you travel out of the country and come back. That's the number one question I get. You still have to quarantine.
Everything else still applies, I think, is the message. So good. Thank you for clarifying that at the end. And look, the hour is over already. It just went so quickly. I'll just take a moment to wrap up and let all of our guests know what is next steps in terms of our webinar today. We did not get to all the questions. And of course, there's more questions that have come into the chat this evening. So we're going to do two things as a follow-up. We are going to have the audio, perhaps or actually, I think it's the video. Ms. Sherilyn, you can tell me in a message here if it'll be just the audio or the video that's posted. But we will have this session posted on our website in the next couple of days. And we'll make sure that we give you some information with time stamps of where particular questions have been asked, so that you can go right to that section of the webinar if you care to do so. The other thing is that we have been gathering the questions that have come in the chat. And of course, the few questions that we didn't get to this evening that were sent ahead of time. And it'll take us a few more days, but we'll get some answers to those questions in a written format and notify you when those are available. So thank you. In conclusion, I just wanted to take a moment and thank all of our panelists, Dr. McKee, Dr. Daly, and Jacqueline, for joining us this evening and for providing us with a better understanding of the updates to the childcare health and safety guidelines. And thank you to all of the childcare providers who joined us on the call this evening, for the opportunity to learn a little bit more from our professionals.